Well, New Mexico has undertaken several successful efforts to address health workforce shortages, including growing our own. The Health Leadership High School opened in Albuquerque just last month and will prepare students to enter a variety of health professions, creating a healthier New Mexico. The school's executive director, Gabriella Duran-Blakey, hope I pronounced that right, joins us with more information. Good morning.
Sure, good morning.
Tell me, how did the concept of this school begin?
So here in New Mexico and nationwide, we have a shortage of healthcare workers, and we also have plenty of students who are disengaged in school or dropping out at an alarming rate. So our school is really designed to connect the two industries and prepare students to go into the health field. Specifically in New Mexico, we need professionals in the health field that are from the community, that are also taking care of our own community. And also preparing students to become healthier themselves and become healthier leaders in our community as well. And so kind of re-engaging students a little bit in school in some different ways, and providing some workers for our industry that so much needs help.
Very cool. So hence the growing our own, like right here locally. That's very cool. What type of student is this school for?
So our school is a small school, and it's very hands-on. So, and of course they have to have some sort of interest in the health field. Most of our students come to us and they really want to be a pediatrician or a veterinarian, because those are the two industries that they interact with the most. But as we work with them, their eyes are open to all of the different jobs that are available in our health community. And so we prepare students that just need a little bit more of a hands-on, small environment and really relevant education, so that we never hear in our school, why do I need to know this? Because it's evident that they need to know it to be prepared to go into the workforce.
That can be frustrating.
Right.
Yeah, your focus is one thing and yet you're having to learn.
Exactly.
Yeah.
Exactly.
What learning opportunities are available for the students?
So our students, just in the, we've been open for 3 weeks, and we have spent probably more than 50% of our time hands-on at UNM, really learning about the School of Medicine, the different programs that are offered. We went to sports medicine, spent a day with the athletic trainers there so they can see all that's offered through that realm of work. We went to the School of Pharmacy. They went to the Bat Cave where all the simulators for the School of Medicine are.
Oh, okay.
And so they've really gotten to open their eyes and see the different jobs that are available. We're going to CNM next week. We went to the zoo for behind the scenes with the vet of the zoo. Some of the students who wanted to be a vet started to think maybe they wanted to go into phlebotomy. And so we've had a wide spectrum of opportunities just in the past 3 weeks for students to start gauging what is their interest.
Very cool. And it's a pretty lucrative career, correct?
Right. And so, I mean, and the ability in the medical field to have an entry-level job and move up is huge. And so our students, can go in and get very well-paying jobs just from the beginning.
Very cool. Tell us just a little bit about the curriculum.
So we have a project-based curriculum. So probably when you and I went to school, you go from math, the bell rings, you go to social studies, the bell rings, and everything's kind of disconnected from each other. In our project-based curriculum, the students have projects rather than classes. And in the projects, it's all health-related, and they're actually developed by our industry partners. So we have partners in the health industry who have helped us create the projects, so that we know when the students are in the projects and what they're learning is not only relevant to the content standards we need to teach them in English and math, but it's relevant to the skills they're going to need to go into the workforce, because the industry partners really drive our curriculum. So everything is very hands-on. Nothing is really sit and get. Nothing's disconnected from each other. It's very engaging, and it's actually really fun.
I would assume very successful too.
Yeah.
Yeah, definitely. How does the faculty help students succeed?
So we have a really low student-teacher ratio. We have about 15 students to 1 teacher, and those teachers work in an advisory with the students. We have a really strong approach to a 360 approach for children, and so we want to make sure that we take care of the whole child before just throwing them into a classroom. And so the teachers really work on all of the social emotional things that happen with teenagers that are coming to us to kind of keep them in, yeah, so that they know, it's one thing to say, oh, sit down and listen, but when you find out what has been happening to them just in the morning or day by day, they come to us with all kinds of things going on. Our teachers really take a hands-on approach with our students to make sure that they're working with them. We have social workers on staff It's a very collaborative community of taking care of each other.
Very cool. How many students are enrolled right now, and are you still accepting students?
Right, we are accepting students. So we have students that are enrolled now for 9th and 10th grade. And we are open for about 30 more students. So students who are disengaged in school, maybe some students that thought that this year was going to be different and they tried, we're still open to have students, even though the first day has already started. There's plenty of time to get students back involved in our school.
On that, real quick, tell me how people can get more information.
So they can call us. Our phone number is 750-4547, or they could check out our website, www.healthleadershiphighschool.org. We're also on Facebook and Twitter.
Very cool. Well, thank you so much
Sure,
for joining
thank
me
you.
on the couch.
Thank you.
Well done.